A drug-seeking patient is someone who is seeking drugs of dependence, and they're seeking those usually for their own use, and usually got a substance use disorder behind it. We don't really know how many patients GPs truly see that are drug-seeking, either because they have learnt behaviours that trick us, or they are patients that have genuine issues. I consider them all patients still. They've got a substance use disorder in addition to their genuine issue, whether it's an anxiety issue or pain issue. So it needs to be an approach from GPs to think everyone's at risk. How can I minimise the harm of developing dependence through my prescribing and having a system in place very early on, so we're not waiting until the penny drops. These drugs are dangerous. I mean, they're called controlled drugs. They have to have extra controls from our point of view as well as the legislative side of ththings. An overdose from prescription deaths in Australia is exceeding the road toll, so it's a big problem. A number of patients also die taking the drug as prescribed. It's not always addicted patients. We've got to be very cautious of these drugs, and I think sometimes we're just a bit blasé about how dangerous they can be. People don't go into drug use to develop a problem. It develops around them, and then they look back and think, oh my goodness, it's too late. So destigmatising is an important part of that. Then offering real care. Chronic anxiety, chronic pain needs much more than a script, and we're well placed to look at that. One of the most important things though is the concept of a medical home, having the patient engaged in treatment in a consistent spot. Having a consistent GP or GP clinic that can look after things, can monitor the patient over time, monitor those changes, look at a trial of a medication, see whether it works and review that. So that continuity is really important for these patients.